I'd like to finish with some comments in general. Firstly, I need to acknowledge that the government has worked very quickly to develop this package. We always give credit where it's due. Governments consist of humans. None of us is perfect. The government has included in its package a mechanism for fixing any mistakes in what is a very complex welfare system. Secondly, I acknowledge my staff for anticipating people's needs immediately the legislation was passed. They recognise that people will need clarity and support, and then I want to compliment my staff for assembling these notes and checking and checking and checking. But it's up to you to check for any updates the government has passed after I read these notes. Thirdly, I want to emphasise that coronavirus, COVID-19, is a serious threat to people's health. This must be government's first priority. Some people are still not getting it. This is serious. Now, there are two health risks. The obvious impact on people catching the virus, that can be mild. It can be non-existent because people don't have any symptoms at all. They just cruise through it. Or it can kill people. But secondly, there is the threat of overwhelming the entire healthcare system and especially intensive care units. If we do not protect our healthcare systems, then more people will die from the virus and from other accidents and illnesses because they can't access a stuffed intensive care unit system. This challenge is increased because coronavirus is so easy to spread. It is contagious, in cases highly contagious, and some people with the virus don't even know they have it, so they spread it unconsciously. Could be one of your friends, a work colleague, someone you have never met, someone you'll never meet again. We don't know. The first priority, people's health, means we must isolate either the whole population or isolate those with the virus and isolate those vulnerable to it being serious if they catch it. The second, that's isolating the people with the virus and isolating people who are vulnerable to the virus, requires massive testing, and Australia doesn't yet have that. These are the two ways to stop it spreading. Isolate everyone, or isolate those with the disease and those vulnerable with the disease, to the disease. We must protect people and protect our healthcare system. I have to admit that I was initially blasé about the virus. I didn't think it was a big deal. My son woke me up to that with some overseas data that he got from the United States while he was there. We can see the sad consequences of being blasé in Italy, other European countries, possibly America, and initially Britain, where governments were less diligent than they needed to be. East Asian nations like Singapore, Taiwan, were quick to jump on it and have minimised the impact not only on their people's health, but also on the environment and on the economies, as I'll explain. Another East Asian nation, South Korea, was reportedly initially like Italy. They were taking it easy. They quickly changed their strategy when they realised the seriousness. They are now apparently on top of it, and like Taiwan and Singapore, reportedly have low impacts on their people and low impacts on their economy. They use a combination of massive testing, they're taking of people's body temperatures. That way they can screen only people with high temperatures, and then testing people with high temperatures for coronavirus. So they don't put a massive strain on their coronavirus testing. And then if someone fails the coronavirus test, they isolate those people, strictly isolate them. Isolating the virus so quickly means that they can quickly and safely get healthy people back to full-time work so their economy suffers less. It's ironic, isn't it? By focusing on people's health, primarily and mainly, then they improve their economic impact as well. In these East Asian nations, I think they initially hit the virus hard with a lockdown and then got on top of it. Instead of balancing human health and economic health, they focused on health. That meant they got on top of it quickly, and that minimised their economic impact. Now, Australia is fortunate in being later in the cycle, and we can learn from Italy's mistakes and from East Asian successes. Now, I saw some data, only a little bit of data. I realised I was wrong to be blasé about it, and I admitted my error and changed my mind. Yesterday, I wrote to the Prime Minister to advocate that if necessary, we need to take a much stronger approach than we're currently taking. That is his government's responsibility, though. The people of Australia elected his government. and I hope he accesses the best data from around the world and the testing equipment and personal protection equipment needed to keep us all safe. Regardless of what the government does, we each have a responsibility and a part to play in stopping this sinister virus and minimising damage to our economy. Now, in our office and in Pauline's office, Senator Hanson's office, we are already turning to the future. We are documenting the lessons learned, and we will develop responses to restore our country's productive capacity and economic resilience. Both our productive capacity and our economic resilience have been destroyed over the last 4 decades under stupid, globalist policies, starting with the Hawke Labor government in the 1980s and accelerated under the Howard Liberal Nationals government and turbocharged under the Rudd-Gillard Labor Greens government and the Turnbull Liberal Nationals. Now, I must recognise Tony Abbott as Prime Minister, who initiated a program to ensure a stockpile of medical equipment, protective equipment, and other emergency equipment and provisions. Sadly, we're told that Malcolm Turnbull's government watered down that scheme. We have no idea where it stands today. Liberal Senator Richard Colbeck, as Minister for Aged Care and Senior Australians, admitted in the Senate on Monday that Wuhan in China is a source of much of the world's personal protective equipment for dealing with this virus. Yet Wuhan is the source of the virus itself. So this is an example of how globalism and interdependency have made us vulnerable to threats, physical, defence, and medical. Our country's leaders have fallen since World War II for the globalist narrative, pure crap, that we should be interdependent. As I've said, though in the past, in the Senate and publicly, and again in the Senate last Monday, when we are interdependent on other nations, that makes us dependent on those nations. That makes us dependent. We must restore instead our productive capacity and economic resilience. We can only do that through economic independence. We can continue to trade, but it must be fair trade, not free trade that is set up for foreign corporations or foreign governments. We can continue to interact with other nations, yet we must do what is best for our nation. Australia comes first. We need to restore our manufacturing, restore our agriculture, restore our fishing, and restore other industries. And we must remove the chains of stupid and sometimes treasonous UN regulations that are wrapped in global bullshit from the elites. We will continue to work hard to bring back Australia. Finally, while central government is often the source of our problems in Australia, at the moment in facing this health and economic crisis, we must follow the government's plans and watch them to hold them accountable. It's time for all Australians to remain calm and to take care of ourselves, our families and our communities, especially the vulnerable. The core to overcoming challenges is calmly getting the facts, calmly getting the accurate data, calmly building and having a solid plan based on the data, calmly informing people of the data and the plan, calmly continually listening, watching and learning from all people. We don't know who amongst the 25 million of us will come up with the next great idea. Calmly checking the plan's progress and above all, calmly working together. It's time to work together while watching and holding those in authority that we have elected accountable and developing a plan for the future. We hope these videos are of assistance to you.